So I'd like to welcome everybody to the Medical Marijuana Awareness Seminar. Tonight's topic is going to be gastrointestinal disorders, something that is something that unfortunately is not fun, but is definitely with us. And we're going to talk about how the medical cannabis can treat, at least be able to help with that particular medical condition. A few housekeeping things before we begin. You'll notice over here, probably right about there, you'll notice a little Q&A. Looks like two little circles. We're here to answer your questions, and please feel free to answer questions. And if you could type it into that particular area, that would be great. We actually want to monitor that and get all your questions answered either during or after the webinar, depending on the appropriate time. The other is that this is a webinar that is a topic that's sensitive to a lot of people. So we really want to be able to really have questions that not only just stick to topic, but also ones that we feel are really personal things that can help you. So feel free to bring the questions. We're here for that. And to that end, I'd like to introduce my co-host tonight. I'd like to introduce Zach. Jack, I can't really pronounce your last name, so I'm just going to leave it as Zach. Zach is with Trulieve and has been working with a number of doctors in the Jacksonville area and has some background in this particular area. So Jack, welcome and thank you for joining us, and tell us a little bit about yourself.
Yeah, thanks, Marc. So as Marc mentioned, my name is Zach Franckhauser, is how you pronounce that. I've been with Trulieve since 2016, non-consecutively. I've probably worked for them for about 4.5 years. I went on to get my degree at Florida State. And then I came back in my role currently as a community educator, where I work with about 150 different physicians in the Northeast Florida region. Where I'm at right now is actually Daytona, working with some of the physicians over here. But I do also primarily work in the Jacksonville region, again, with over 150 doctors, educating them about the benefits of medical cannabis, as well as the products that Trulieve offers that can help their patients and their certain symptoms.
That's great. So Zach, let's get down into talking about gastrointestinal disorders, as well as how medical cannabis can help it. Everybody, we don't want to make this a webinar on slideware. We want to make it interactive to answer your questions. But we are going to put up some slides to be able to hopefully provide some information to you, and then the others to be able to not only help you answer your questions, but I'll be able to explain a few things. I'd like to welcome everybody here. It's important that we point out what we're trying to provide here is really safe, supported, judgment-free information. All the information that we have and put together in this webinar has been vetted by doctors and advanced researchers. And as you notice, as you know, here in the United States, there's not a lot of research being done, but we work with researchers in Israel, Germany, France, Spain, a number of places that have contributed to this particular topic. So we try to keep it as scientifically accurate as possible, because here in the United States, it's just hard to find good, solid information. Like everything that you do in the medical field, we always advise that you talk to your physician anytime you're going to do anything that has to do with your health. Naturally, we would prefer that you have a physician that is favorable to medical cannabis, and quite frankly, in this day and age, most are. And if you don't have one that's that way, my suggestion is to find one, because you need to know what your options are, and you need to feel comfortable with your options. And that's what we're really trying to help promote.
Yeah, and actually, if you do not have a physician, you can find one on Trulieve's website. We actually have a tab for Find a Doctor. Perfect.
That's great. That's great. So let's talk about gastrointestinal disorders. So what are they? What's fascinating is that 1 out of every 5 people here in the United States suffer from GI disorders, and that's a big number. A lot of people don't look at it that way, but they have a problem. We hear about IBS, we hear about GERD, we hear about IBDs, whether that's Crohn's or whatever. These are all things that fall into that gastrointestinal disorder category. And so I'd like to do is kind of really drill down on this a little bit, because what we're doing is we're talking about it's called an enteric nervous system. And what that is that's the system that is all the nervous system that helps. It's a mesh of neurons in your body that controls your GI tract. That's where a lot of the conditions that you hear about GI tract problems come from. And quite frankly, almost all of them are related to inflammatory pain. That's what's very fascinating. Why medical cannabis works so well with GI tract problems is because medical cannabis is really something that really helps contribute to helps address and helps be able to relieve a lot of the inflammation in your body. So depending on the conditions that you're looking at, and there's a number of them that are out there, and I'm not going to go through each and every one of them. If you have one of these, you'll know it. The point is, most of it is caused by inflammation, and that's kind of a bad news and a good news thing. We know what the problem is, and the good news is we have something that potentially could help.
Yeah, and Marc, just to add on to that, THC, CBD, both great for their anti-inflammatory properties, but something many patients aren't aware of is sometimes that their medication that they're taking, their pharmaceuticals, can cause that top condition, which is constipation. The great thing with cannabis is actually it has bowel mobility, so it actually allows for your bowels to flow more freely and won't necessarily hold that constipation. And the great thing is that, we're not sure exactly which cannabinoid it is, whether it's CBD or THC, due again to the inflammation properties, but these are both found in many cannabis plants products as well.
Yeah, and that's a good point. There's been a lot of research, and cannabis has been an effective product for it. How effective is it? Well, from an efficacy standpoint, this is a 2020 quote. I tried to bring one that's fairly new from a medical doctor, and they talk about digestive disorders being treated by medical cannabis as a beneficial solution, and it's something that has been researched. Now, this is some research that goes from 2001 all the way to 2006. I also brought you some other information. These are more studies that are out there going from 2007 all the way through 2017. There are some studies in 2018 and 2019, which we will be publishing after this. But there's a lot of research on this. Now, I do want to point out, most of this research is not done in the United States. Most of this research is being done overseas, primarily in Israel. They're looking at also places like Spain, Germany, England does some studies. But there's been a lot of studies at this. This is a big problem that a lot of people want to take a look at. And again, overseas, where they're more friendlier towards homeopathic medicine and holistic medicine, what you'll find is they have really taken a look at this, and cannabis is something that's being recommended as a treatment. I think it's important that this comes up, because this is the comments we're making, and this is based on science. It's not just based on anecdotal information that we see that's out there.
Yeah, and one thing I actually read earlier, which might answer the question that we have in the Q&A regarding GERD, was a report by Temple University which showed cannabinoids caused a decreased rate of transient lower esophageal sphincter relaxations, which is the leading cause of GERD. So just so you're aware, cannabis is a huge producer of multiple cannabinoids. Again, main ones being CBD and THC, but many other phytocannabinoids as well.
Right, and there's again, you asked the question of how does it help? Well, it helps be able to relieve the inflammation, but don't forget, and we'll be talking about the endocannabinoid system. There is a number of receptors in your body that cannabis does work with, and being able to address those and be able to provide relief and medication to those particular receptors that are there. Now, before we get too far into it, I want to thank everybody for attending tonight. I know that it's 6 o'clock on a Wednesday. And it's a couple of things that you may want to note before we dive into how cannabis is going to help Crohn's. If you go to Marijuana Aware, there is going to be a follow-up. If you go to the follow-up tab, you'll be able to view a video of this particular webinar. It's a follow-up to a YouTube video. You'll be able to see the slides. And also we have all the researchers, the research information is all out there. And it'll probably get posted this weekend, no later than Monday. But you'll be able to see the information that's out there, and so it's a place to do the follow-up. I also want to point out that if you go to this particular link, MMTC has a patient information brochure, and that brochure is a booklet. It not only is a step-by-step guide on how to get your card, but also it has a ton of information in there. If you are using medical cannabis, about how it works, what it does, it has dosing schedules, it has a number of forms. It's there to be informative, and on top of that, almost all of you'll see ads for people like Trulieve that are in there, and they have specials and discounts that are there. So please feel free to look at the brochure and check it out. If nothing else, just to hopefully save you a little bit of money on your medication. Speaking of saving some money, we also have 10% off if you're going to look at getting a medical marijuana card. If that's one of your questions, MMTC Clinics is one of the sponsors of this particular webinar series. We'll provide you a 10% discount. If you give them a call, there's an 800-850 number here, and there's a coupon code, which is MMAW10, and that'll get you a 10% discount off of your clinic visit. And then also, if you're looking for hemp-based CBD products, because a lot of people we're going to talk about CBD as something that helps with this, you'll be able to find doctor and physician approved hemp products. One of the problems that we've run into is what's the quality of the products that are out there, and how do you find good hemp products? And that's what we provide here. Now, we are believers in medical marijuana, and we're promoting medical marijuana, but we also understand hemp is an important part of the equation, and that's why we supplement what the dispensaries are doing with some hemp-based products to help our patients be able to address their medication needs. And that has a discount code as well, MMAW10. So thank you for attending, and here's some things you may want to take a look at. So Zach, let's talk about the endocannabinoid system. This is something that's it's not relatively new. Everybody's had this thing since every mammal has one. We really discovered it in 1940, but it really came to light more in the 90s with the research that's been done around medical cannabis.
Yeah, in the ECS, it regulates so many different things, especially relating to GI. When it comes to inflammation, regulating pain, your mood, appetite, nausea, memory even, and emotions especially. So, the ECS, again, as Marc mentioned, is something that all of us have been born with. We have what are called the CB1, CB2 receptors, CB1 primarily being found throughout the central nervous system, as CB2 being more so found throughout the GI. But these cannabinoids, they work as a lock and key method with, other cannabinoids such as CBD, CBN, and THC. And essentially our body produces its own endocannabinoid called anandamide, which allows us to then be able to produce or carry, THC and CBD alongside the neuropathic ways, and being able to provide relief via CBD, CBN, THC. And again, just especially when it comes to levels of anandamide being much lower in your inflamed gut mucosa, that's especially related to IBD. Yeah,
I think you covered a lot of really great information. So let's kind of walk through that, if you don't mind. I think it's important. Your endocannabinoid system is part of your body that regulates, this is how your body regulates pain, memory, appetite, inflammation, in your immune system, which is what GI disorders are all about. And as Zach mentioned, it's a lock and key. The CBD, CBNs, THCs all work lock and key with your body. Your CB1 receptors are primarily found, and these are these light blue receptors here. They're in your brain and your central nervous system. And your CB2 receptors are mainly found in your peripheral organs as well as your immune system. So we know that these are there, and they've been there for a long time. What's fascinating, as Zach appropriately pointed out, your body produces endocannabinoids, and those anandamide are something that your body uses to be able to, again, regulate pain, appetite, pleasure, immune system, mood, memory, that type of thing. When your body sees a problem, it generates these endocannabinoids, and it sends those endocannabinoids to that part of your body. Now, where does cannabis come into play? Photoendocannabinoids, which is your buds, your tinctures, your extracts, they also are cannabinoids that work lock and key with your body. They're very simpatico. And what they do is they help your body to be able to manage itself. And why would you use that? Well, let me give you an example. I'm a senior citizen. And so my body doesn't produce the endocannabinoids like it did when I was 25, 30, even when I was 50. So this is something that can actually help provide my body the basic raw material that it needs to be able to go in and to be able to manage itself. So I think that's really important, that it's something that's natural to us, and it's there. I do want to mention, and people have brought up, there are synthetic cannabinoids, and this is where pharma gets into play. Pharma wants to be able to play in the cannabis business, and they're trying to figure out how their lock and key is to be able to patent this stuff. And it's very hard to patent a natural product like cannabis is something that's grown in the wild. My position on synthetics is real simple. I don't see how you can ever produce an apple, an orange, a pear in the lab. You certainly can't produce cannabis in the lab. Now, you can produce certain components of it. For example, there's something called Marinol. It's a THC only that has been produced as a synthetic. But when you get into synthetics, you have to be extremely careful. I'm going to say that again, extremely careful, because they have only use these under the control of and in conjunction with a doctor's guidance and supervision. These are things that are something that I just think for the average person is something to not play with unless your doctor brings it up. So I tend to discount this synthetic cannabinoids as an option, but I do bring it up because you'll hear about it and you may see it, it's there, and you should know kind of what they are and at least what they're doing.
And, I kind of talked to you about this yesterday, Mark, but a good friend of mine, his father actually had been prescribed Marinol, and he oftentimes would mostly, consume cannabis in its whole flower form just because of the other benefits that it provided versus what synthetic cannabis can provide. And again, I also just wanted to reiterate regarding IBD, levels of anandamide were much lower in the inflamed gut mucosa. So anandamide, again, an endocannabinoid, being able to carry these other cannabinoids such as THC and CBD to the gut mucosa can often relieve these symptoms that IBD can produce.
Sure. I mean, cannabis has 450 known medical properties. So that's something that's really important. A lot of your synthetics clearly don't get anywhere near that rate. And we'll talk a little bit about that as we go on. But, I think there's a perception that people have that when you take medical cannabis, that it immediately goes to your goes into your CB1 and CB2 receptors. In reality, it really doesn't. What it does is it goes into the fatty acids in your body, and the fatty acids work almost like a battery to store the energy your body needs to be able to manage and to be able to heal itself. The neurons in your body, your nervous system, will identify if you have a problem. In my particular case, I had a left knee replacement, so I have to worry about swelling and inflammation. I also had an automobile accident where I had 7 herniated discs in my neck, which is not fun. My body knows there's a problem. And so it's trying to produce the endocannabinoids to be able to address the inflammation and also the pain that I'm going to. So what it does is it takes that cannabis, turns it into long chain fatty acids. And then what it does, it sends this through the bloodstream to that part of your body that needs the medication. Now, this is kind of important for 2 reasons. Number one, no one has ever died from using medical cannabis. Candidly, no one's ever died really from using recreational cannabis. The World Health Organization for the last 40 years has been monitoring this and have not found one case of one death from cannabis, which is very fascinating. The reason for that is because it's your body producing its own medicine to be able to try to heal itself. It's not a foreign substance, which is what the pharma drugs really bring into play. It's a natural substance that's really helping you. The other thing that's fascinating is because the neurons know where the problems are in your body. You don't need a doctor to tell your neurons there's pain in my knee or there's pain in my neck. The day just knows it. So your endocannabinoids your body produces the endocannabinoids to address both of those conditions. And usually, and that's called the entourage effect. You take it for one purpose and it works for a couple of places in your body. I have a friend of mine who takes it for her arthritis in her hands. It took her about 3 weeks to be able to unclench her fist to the point where she could actually hold a glass, hold a spoon, and be able to go out and eat dinner in public, and which she hadn't done for literally almost 3 years. But at the same time it did that, it got rid of the pain in her shoulder, and it also helped her sleep through the night. So those are what we call the entourage effect. Your body knows where the problems they are, and it uses the cannabis to be able to address that. Zach, have you seen the examples of that?
I mean, in terms of which part? I'm sorry.
About the entourage effect.
Oh, yes. I mean, the entourage effect is seen literally every time you're smoking whole cannabis, when you're able to use, all the major phytocannabinoids and being able to then, use those in conjunction, again, with CBD, THC, find these in many full extract cannabis oil products, as well as many different RSO is just another one, for example, many different cannabis products that you can use.
Yeah. So this is something that's really important. And I want people to feel comfortable that you're not taking your life in your hands by using by using medical cannabis. In fact, if anything, it's fairly safe. And it is something that, don't be surprised if you take it for one thing and another part of another alligator that's run around your body causing a medical condition causes a problem. Now, let's talk about medical cannabis for a second. There's really 2 components, CBD and THC. Zach, what are the differences?
Yeah, I mean, for this case, for GI, some of the main common components are going to be, the anti-inflammation properties, but more the difference is CBD It's non-psychotropic. It's not going to, cause the quote unquote high that many people are aware of. CBD is also a neuroprotectant. So, many people often like to talk about psychosis with THC. With CBD, again, being a neuroprotectant, in theory, it should be able to protect situations like that from happening. And again, with THC providing more of the psychoactive effects, CBD can be used in order to, maybe calm those effects. People have found where, maybe some people have experienced what they like to call an overdose on THC. And if you have, a little bit of CBD nearby, it can be able to, bring you back down to those levels. THC, again, has many of its own great benefits in terms of the anti-inflammation properties, the antiemetic properties, which are great for nausea, CBD having anxiolytic properties. So maybe being able to use these in conjunction, such as one-to-one products, which we'll go over in a little bit, you can definitely, find the differences in the two, but the two themselves actually have very similar properties as well.
Sure. I think that as a general rule, I tend to look at the CBD products as helping a lot with inflammation. And I look at the THC products that help a lot with pain. I'm just generalizing that, but I'm saying that's kind of in my mind. That's where I kind of headed those category of products when I'm trying to address whether it's inflammation or pain. Now, there's also, cannabis comes from, I say the medical, the tinctures and the drops and everything, they really come from two types of plants. One is hemp and marijuana. Why don't you tell us about the difference between them, Zach?
Yeah, so scientifically, they're technically the same genus. They both come from the same species. Legally, which is where we actually get our definition, is where it has 0.3% or less THC. So hemp-derived products will contain less than 0.3% THC. Why that's important is, again, we're trying to achieve the entourage effect by consuming products that do not carry, especially more than 0.3% THC. You're not able to really get full entourage effects. CBD in the hemp form is also more found with industrial goods, textiles, building materials. One cool fun fact is that we actually, the USS Constitution, located in Massachusetts, its rope is made from hemp rope. With marijuana, that's going to be, again, more of the psychoactive effects. It's going to have more of the, more cannabinoids such as THC, CBD as well. So when you are deriving those tinctures, those oral products, you're going to get more of each cannabinoid, therefore providing more for that entourage effect. And again, as Marc mentioned earlier, marijuana itself, and at least with THC, is going to have more medicinal properties than just hemp alone, where hemp is specifically grown for, again, CBD mainly, where you can get isolates of it, you can get full hemp extract oil or broad spectrum. But as well, again, just to reiterate, you're not getting that full entourage effect. And one other thing Marc mentioned previously was many of these products that you'll find are coming from your local drugstore. You just need to be careful with what you're consuming, because many of these are not regulated or lab tested, unlike the products that you'll find in your medical marijuana markets.
Right. Yeah, and that's really important. We'll dive into that, the quality of the product in just a moment. But typically, CBD has CBD from hemp has 82 medical properties. With CBD from marijuana has 108 medical properties. But when you put CBD and THC together in the cannabis plant, that's why we talk about whole plant in marijuana, there's 450 medical properties. So you can see there's a lot of differences there. And the CBD wheel, I think, helps explain what I was just talking about, where you have, for example, CBGA helps reduce inflammation, but over here you'll find it so does THC. So what happens is 1 and 1 is kind of 3. They kind of work together to be able to address that particular situation. So having a cannabis based product really helps you be able to address inflammation a little bit better, which is the key. And at the same time, it's usually a little bit better. In fact, most of the times, it's a little bit better at helping to address any pain that you might have from the GI tract disorders that are there. Now, how effective are they? Cannabis also works with the terpenes, and we'll talk about terpenes in just a moment. But really, the terpenes are really important because they help to be able to guide the products right to that particular problem that you're having and be able to address it. So, any comments you have, Zach, on this?
Yeah, Marc kind of mentioned the majority of that with the CBD wheel and being able to, in conjunction with marijuana or THC, being able to then combine those for the entourage effect, which again, your cannabis plants are going to consume more of those CBG, those other major phytocannabinoids, which can help with many different causes. Again, THC, CBD having many of the same components, but they also have many different components to them that can help for numerous, conditions. But then when we also look into the terpene profile of it, you can actually find, these are what give the strains the unique ability to do what they do.
Sure. And when you talk about how effective they are, a lot of it has to do with, as we point out down here, it really has to do with how your endocannabinoid receptor system works in each of your bodies. So we're going to talk about that in just a moment. But before we do that, there's a couple of things one thing we need to cover. When I got in this business 8 years ago, all I heard was about sativa and indica, which is still pretty much, you hear a lot of that, sativa leaning and indica leaning products today versus sativa and indica. But Zach, tell us the difference between them.
Yeah, well, many people are aware that sativa is going to be more of the uplifting, euphoric effects. They're typically, when they're grown, they're tall in stature, narrow leaves, typically take a longer flowering cycle. But these, again, are more of the psychoactive head feelings, the creative thoughts. Many people with anxiety, this isn't typically the best product to send them to. So then we, look at indicas, where indicas are typically short in stature, they're broad in leaves, shorter flowering cycles. Many people love indicas because of a main terpene we'll go over here shortly called myrcene, due to its sedative effects. But some people, they don't like that, too sedative of a feeling where they can't go throughout their workday. So, we have other products where you can get hybrids. And that's something else that we're kind of getting away from, is the sativa indica, because of the pheno hunting that's going on. But really, it is difficult to find a true indica, true sativa strain as we begin to, again, going through more pheno hunting and producing more phenotypes.
Yeah, what you're really doing, people like Trulieve is doing, is trying to use these particular products and accent them and use them and really bring out the medical properties that are within them. And it's not only just the actual cannabis itself, but it's also in conjunction with the terpenes and the terpene profiles that go along with that. And we'll talk about terpenes in just a minute. They are very important. But I think before we do that, there's been some questions, and there's a question about how much should I take, what should I take, what's the dosing methods. Really, cannabis is something that is something that has to do with the biology of your body. And I say that because in the pharma world, you take 2 pills and call me in the morning. That's kind of the philosophy that's out there. In this particular area, what we're talking about is something that really tunes in and works in conjunction with your body. And I say that because, let me take alcohol for a second. Some people drink one drink and they're done for the night. Other people can drink the whole body and they're just getting going. That has to do with your body. That has to do with your biology and how your body reacts to alcohol, for example. Well, cannabis is the same way. Some people are very tolerant to THC and CBD. Some people are not very tolerant to either CBD or THC. And so that's what we need to do, is we need to figure out, it's almost like when you first get your first drink, you got to figure out what your tolerance is. We got to figure out what works for you and what you like. And that's what's really important. So yeah, we have a philosophy called go low and go slow. Zach, you want to comment on that?
Yeah, that's actually a great point regarding your biology. Many people, again, each person's different. We all have different genetic makeup. So, for some people, when they use sativas, they get the exact opposite feelings that many people are used to. And the same thing can be said with indica, where maybe they consume an indica plant and it gives them uplifting, euphoric effects. And that's, again, just different biology, different strokes for different folks. And it's, as Marc mentioned, going slow, starting low, going slow, being able to find what works best for you first, using maybe 10 milligrams at first, seeing how that works, and then going up from there to really figure out, the best way that your body reacts to each medicine.
Yeah, and this doesn't take very long. It probably takes a week or 2 weeks to be able to dial it in. And once you dial it in, you'll be able to get your life back. But it's important to start off with an equal amount of THC and CBD and THC. That's why people talk about 1-to-1s. Very a low dose. Take it a day or two. Find out if it does do anything. If what your body's reaction to it is. If you're still trying to handle more pain, you might want to up the level of THC, maybe 2 THC to 1 CBD. or if you're worried about inflammation, if that's one of the issues, especially with the GI tract, you may want to increase the amount of CBD, like have a 4 CBD to 1 THC, or even as much as a 20 CBD to 1 THC. That's out there. It just depends on what's good for your body.
And this is a journey for sure. Just know that Trulieve is here for you. One great thing that Trulieve offers is our no questions asked return policy. When you're going through this journey, if you're getting products that aren't providing the relief that you're seeking, if they're giving you different effects than what you were expecting, feel free to go back to our dispensary and bring those products back. You'll get a credit on your account and be able to choose maybe a different product. Maybe it's going with a higher ratio. Maybe it's going just with a different strain. Just really figure it out. We are here for you. We have virtual consultations as well. So if this is something that you need, take full advantage of it.
That's very important. Having virtual consultations, you're going to find that you have a medical team that's behind you to help you with medical cannabis. Naturally, it's your medical doctor, but it's also your medical marijuana doctor, and it's also your dispensary, and also yourself. Listen to your body. Your body will tell you what's working and not working. Your body. You don't need a doctor to tell you where you have pain. But you definitely need to listen to your body on whether it's being relieved or not. I know that there was one question asked, I think it was asked by Carrie, what should a normal person take? I don't know, and that's because it goes to your biology. All I know is that you probably should go low and go slow to start with, but probably you'll be able to figure out pretty quickly how much, there's the quantities, 10 milliliters, 25 milliliters, 50 milliliters, or be able to find out whether the ratios 1 to 1, 2 to 1, 1 to 4, that type of thing. Those are something that you really got to be able to experiment with and find out how that helps. Now let's talk about terpenes, because terpenes are really, really important. That really helps to be able to drive the medical marijuana for you. I know we talked about the endocannabinoid system being the highway. Basically, the anandamides are the driver. That's what actually drives the particular. It's driving the solution that your body's looking to its medical condition. Cannabinoids are the passenger that's on the highway, but the terpenes really help you navigate and really help you dial in exactly what you need to be able to help you. So you want to tell us a little bit about terpenes, Zach?
Yeah, so terpenes, they're found in literally everything. Whether it may be the wood desk that I'm sitting at, which is going to have possibly alpha pinene in it, or as you see on the pictures, pinene is naturally found in pine needles, linalool, often found in lavender. Many masseuses will use lavender because it is a natural relaxant. Again, going back to alpha pinene, it's a natural bronchodilator. So people with COPD, asthma could also relieve those symptoms. There's over, I believe, 150 different terpenes that are found in the cannabis plant. So, it's often, smart to make sure you're looking at what strain you're getting, noticing what terpenes are available in those. Trulieve does provide a lab report on all of our products where you'll be able to look and see, hey, I went and got sour diesel this time and it had limonene, alpha pinene, a little bit of caryophyllene. And then what you can do is maybe if that strain's not available next time, we can look at these terpene profiles and be able to see, okay, well, sour diesel is not here available today, but we have what's called Dreamin' Sour, which maybe has a little bit more limonene in it, a little more citrusy taste, but it should still provide the same effects as sour diesel in a sense because of those terpenes. We talk about the endocannabinoid system being a highway and the anandamide being the driver. Well, those terpenes, they're going to be, whether they're the screaming kids in the back seat, they're going to have that navigate the journey along the way, or maybe they're more relaxed, where you have the myrcene, the linalool, where it can be a little bit more of an easy ride. So it's figuring out what works best for your body. Again, the biology, the makeup of what goes into it. Terpenes, they make up the different strains that cannabis products are. They're going to be the ones that provide the different effects. Similar to, again, genetics, you're not going to find one strain that's specific or similar to another unless you're looking at the terpenes, and they're not going to be exact, but they should have some similar properties. Again, touching on some of these other terpenes, one big one is myrcene, which is often found in mangoes. And there's a popular saying about mangoes where if you consume a mango prior to consuming cannabis, you'll actually increase the effects and the benefits that you receive from consuming cannabis. How true that is, I'm not a big mango eater, so I don't know. But myrcene is a very, very popular terpene found in many indica strains that, again, it has pharmacological interest when it is above 0.5% or higher. Therefore, you're going to find it in many different indica plants, and that's going to be a very popular terpene. But ocimene, terpinolene, the list goes on and on.
Yeah, I want to point out that I know when I first got involved in taking medical cannabis, again, I had an auto accident that left me with 7 herniated discs in my neck. Um, I went to my medical cannabis doctor and got a recommendation. Went into the dispensary. They looked at my recommendation. We talked about what my condition was. There was obviously a wall full of products that I could supposedly choose from. And the person behind the counter said, the bud tender said, here's what I recommend. And I didn't know much about it, so I just accepted their counsel. Later, the next visit, I came in and thought I would be a little bolder. And what I did was I asked them, how do you know, out of all the products that you have, which ones will work for me in my particular condition? And that's when the light bulb went off. They took a look at the products again via the CBD wheel to see which components, which strains are in there, which components are in there. They matched it with the terpenes that were good for my condition. And they said, based on the terpene profile and the strains, here's the products you should be taking a look at. And it was like a light bulb went off. This is medicine. What they're doing is they're bringing to me different medications that can help me with various conditions that are out there.
Yeah, and terpenes are actually studied in America. So there are many studies that actually show the effects that terpenes provide. And that's just one added benefit for cannabis.
Right. Now, somebody is asking a question about what strains are out there. There's a number of different strains that have been looked for. And again, it depends on the condition that you're trying to address. And I'm not going to go through each of the different strains. But by the way, this information will be provided, again, after this webinar. You'll get a follow-up email. You'll be able to go to the website Marijuana Aware and see this. There's going to be a posting about the video, as well as the presentation and some reference material. And so you'll be able to have this there. So you can scribble it down, or you can just pick it up from there. But there are different types of strains that really address different conditions based on what you have.
Yeah. And, many of these strains can be found at Trulieve. Just throw a few out here. I mean, especially when you look at fatigue, every single one of those strains right there is actually provided at Trulieve. Laughing Buddha, I know Marc and I have talked a little bit about that one quite recently, and it's a 1-to-1-to-1, which we'll talk about shortly. But each of those strains is available when it comes to fatigue, depression, and anxiety. We do carry strains similar to Pineapple Express. Well, we do actually have Pineapple Express as well in a vape form, but Pineapple Upside Down Cake is also available. Very similar terpenes. LA Kush, similar to LA Confidential. When we're looking at abdominal cramping and diarrhea, we have quite a few. When we think about maybe 1-to-1 products, Harlequin GDP is a great flower choice. We also have ACDC, which is typically more of a CBD-derived plant, but it does have a little bit of THC involved as well. And then just going on for stress, one great thing that I like to use is our 9-pound hammer. But maybe that is a little bit too much for you in terms of too much THC. So we just came out with a new strain. It's it's cute. It's called 5-pound hammer. So it's a 1-to-1 product. It does provide more of the anxiolytic effects that CBD can provide. And again, how we talked about earlier, where sometimes THC can give a little bit too much anxiety. CBD can bring us down and kind of mellow us out, so we don't feel like we're trapped in a small space, if you will.
Sure. And I know one of the questions one of the anonymous people brought up is, it says every time I eat, I have inflammation, and that inflammation causes pain and pressure. Sometimes leading to losing the food that they ate. Can cannabis help prevent that? And the answer is yes. It's a lot of, as we mentioned earlier, a lot of the conditions are inflammation based. So the closer you stay to, especially a higher CBD ratio to THC, probably, I'm just saying, and that's a generalized statement, probably will help you quite a bit. I know that Lori asked a question about the reflex and stomach polyps. Would a high CBD be good for you? And the answer is yes, probably. Again, these are generalized answers because it really depends on your biology and who you are. The best thing to do is to try it. In theory, that should work. In theory, that should be there. But again, your body will tell you as you go out and you try these particular products, they'll tell you what works and what doesn't work. and you'll be able to do the adjustments of both the ratio of CBD to THC, as well as the amount, whether you take 10 milliliters, 25 milliliters, or 50 milliliters, that also has something to do with it. So there's a, it's important that you take your time to be able to try a few of these. But again, it's really not something that takes forever. Within a week or two, you should be able to dial in something that gives you the relief that you want.
Most definitely. And, just a little note that I'm not sure many people are aware of is that, CBD primes your receptors. So using CBD is a great option for patients, especially when you're a new beginner and you're really trying to figure out, what products are working best. Your anandamide being able to provide more more cannabinoids to those receptors. The more you have CBD in your diet, if you will, the better, essentially.
Yeah. Now let's talk about, because there's one other question that came up about the dosing forms. I know that when I got into business 8 years ago, I didn't perceive, especially a lot of seniors sitting on the front porch smoking a joint. Doesn't mean you can't, but I think we've moved so far past that in the last 8 years that there's a lot of different ways of taking it, whether it's sublingual drops, capsules. You want to explain to us the dosing forms?
Yes, most definitely. And as you see, all of these products are brought to you by Trulieve. We have a wide array of products and more than just one option. As Marc mentioned, one thing I often run into when I'm meeting new patients is, oh, we don't want to smoke. And, the great thing about the science that's being developed and the science that's to come, we have so many different forms that you can now be able to consume your cannabis, whether it's our sublingual drops or tinctures. As you see, the 1 to 8, we also have available in 8 to 1. We have vape pens available, such as our True Pods, many different varieties of vape pens. We also have capsules that will be available in 10 milligram and 50 milligram increments. Also available in 1 to 1 CBD, THC, hybrid indica, sativa. Topicals, we provide a great gel. Those are great for isolated pain, especially. Sprays is not something that we carry yet, but it's still something you can find in the industry. Edibles, of course, is a most popular thing now, especially for those who we don't want to smoke. We don't like the taste of RSO. We don't like the taste of the tinctures. Well, now you have something that is more familiar with people, chocolate bars, gummies, cookies, brownies. The list goes on and on. We even have a true powder where you can make beverages with it. So just multiple ways, really trying to deliver these products to patients. And as you see, these are just more of the effectiveness, the efficacy rate, the onset times that you have. Sublingual drops, because they're going through the oral mucosa, that'll typically be a quicker onset time. It'll also last a little longer. With your vape pens, these are more going to be those head high feelings. So it's going to be almost instantly. The effects don't quite last as long as, say, a capsule, where again, you see it lasts more of 5 to 8 hours. Great for those nighttime uses when you're trying to, maybe get a few extra hours of sleep, something to use. Capsules do take a little bit longer of an onset time. So maybe we'll have the vape pen by our bedside to get that immediate effect. And then we'll have the capsule to really back it up. Oh, or maybe you decide you want to use the edibles. These are also something, again, that's great for, being able to digest and being able to have that longevity for effectiveness, especially. Topicals, almost immediately being able to have the rub on your skin, kind of, being a muscle relaxant in a sense. Transdermal patches are available, not at Trulieve, but they are out there. Sprays, again, we talked about. Flower, as many people are aware of, that's going to be almost instantly similar to a vape pen. With the flower, you're going to have more of those cannabinoids involved. But let's say you don't like the feeling of combusting cannabis. Those vape pens are an option for you. And we do have options that are great for the entourage effect too, which will provide all of those terpenes and other phytocannabinoids we talked about. And then one last thing, Crumble or Shatter. This is going to be more for our experienced users who they're more susceptible to the higher THC content, the psychoactiveness. But these are great because of the almost immediate effects and the longevity in them. Being able to use, maybe one hit from a Shatter pen, Crumble, rosin, whatever it may be, is typically similar to maybe using 2 to 3 joints at one time. So again, this is more for your seasoned patient. not something a new patient I recommend to go out and use immediately just because you're trying to cut costs. Don't cut corners. Just again, use some of these other products. It is sometimes a trial and error, as somebody had asked, but there are other products to use. It does not have to just be smoking. You can go with other routes. And just talk to your doctor. Make sure they're aware that you are looking for maybe an oral product, so they provide you with that oral route in medical marijuana and low THC, which in this world is known as CBD.
Yeah, and I might want to point out there's two things that are important. A lot of people perceive flower to be, I'm going to roll a joint and smoke it. A lot of flower is used for cooking. A lot of people use it in cooking and that type of thing. And there's I'd say there's a large portion of flower that's sold used for cooking purposes. So that's just one of the uses for it.
Cooking and vaping as well. There are vape devices out there. They can get a little costly at times, but they're great because they have certain temperature settings. And that's really important when you're trying to preserve those terpenes that we talked about earlier and trying to make sure you maximize your cannabis.
Right. And in my particular case, I'm trying to manage inflammation and I'm trying to manage pain. I've learned over the 4 years I've had this injury from in my neck, that if I can reduce the inflammation, I can reduce a lot of the pain. And I know it's not just a matter of throwing a lot of THC at it. It's a matter of making sure I have the right amount of CBD that helps me do that. Now, when I wake up in the morning, I can have a level of pain between a 7 and an 8 because I have 7 herniated discs in my neck, and that's no picnic. But I also found that I have on my nightstand sublingual drops, and I take the drops because I kind of got my dosing regime down. But it's going to take me about 20 to 30 minutes for them to kick in, and I don't want to live with that much pain for that while. So I have a vape pen right next to it, and I take 1 or 2 hits off the vape pen depending on the level of pain that I'm at. And literally, I mean, this is literally within 2 to 3 minutes, my pain level will drop from a 7 or an 8 down to a 1. And the first time that happens, I know I told my wife, "Chief, this is crazy. What's going on?" And the 4 years I've been doing it, every morning I wake up and do it. And I just think this is crazy. It works. But in my particular case, I don't want to run around all day running with a high pain level. It doesn't help a lot of things. It doesn't help my mood, my movement, and a lot of things. But by being able to get it down to a pain level of 1, I'm able to conduct my life pretty normally. So you can mix and match these. What I'm trying to point out, you can mix and match these dosing forms depending on your particular situation.
Most definitely. And one cool thing, you're just talking about inflammation. I read the other day regarding athletes and people who are working out starting to use cannabis more because of the inflammation or the decrease in inflammation that it causes, really helping athletes, trainers, regular Joe, being able to get back into the gym quicker due to those effects. It's sort of similar to an amino acid in a sense. I did want to answer some of these questions that I just saw come across. Isn't vaping smoking? Technically, it is the same, action, yes. But when it comes to smoking, you're combusting the actual flower product. Therefore, it's going to be heated at a higher temperature. Therefore, it is, again, combusting similar to smoking. You're getting carbon, oxygen in your lungs. People debate on that all the time, whether or not cannabis is different from smoking cigarettes. That's up for debate. I hope for the research to be here soon where we can really differentiate the two. But in terms of the legality standpoint, vaping and smoking are different. And to answer the Florida State form question, that is something that the state requires from the physician. Again, because we know that the effects that smoking cigarettes has caused, we do not quite know the effects from cannabis yet. So that form is required for 2.5 ounces, just so you're aware.
Yeah, and your doctor will be able to provide that form for you if you ask them. Also, I want to address the issue about CBD, THC, and diabetic peripheral neuropathy. Are you comfortable answering that one?
Personally, not so much with diabetics. Just in my opinion, I have not worked too much in that field. So I would talk to your physician more so.
I had a diabetic situation in my life, not me personally. And I did talk to both my medical doctor and my cannabis doctor. And it's true that if again, you have to figure out the right ratio that's good for you. And you have to pay attention to it. It can have an effect again on your peripheral neuropathy. But if you're going low and you're going slow and you're letting your body tell you what's working and not working, it really helps to alleviate a lot of that. Again, a lot of the conditions that cause those problems were people who just went out and took a lot of THC or took a lot of CBD, and rather than trying to let their body tell them what exactly is good for what your body will tell you what works and what doesn't work. You'll feel it. I mean, you'll feel the relief that's there, and it'll get to you very quickly. So the answer is yes, it can. It has for people that have really gone into it, just attacked it with a lot of product. If you're going low and going slow, it should not worsen that condition, but it is something that has happened in the past. So the answer is yes. But it can be managed just by doing the normal process that we use to be able to help us be able to regulate or be able to identify the cannabis that we need. Now, there's one in here about the serious munchies, about trying to lose weight. Go ahead.
One thing I recommend is sativa products for me. When it comes to actually trying to lose weight, sativa products are typically going to carry what's more known as THCV, which is actually an appetite suppressant. So you can then be able to use that, alongside your journey of losing weight. Hopefully one day we'll be able to isolate just that main cannabinoid. That would be awesome for many different people. But as of now, there's not really a great way to kind of manage the munchies. Sometimes what it is there's maybe too much THC in your system. Some people have found that there's just too much cannabinoids in there that can kind of cause the reaction for you to start eating more to feed and nourish your body.
Yeah, I think that I know that the munchies are something that are, let's just say, a side effect of cannabis. I have just kind of taken the philosophy, at least with myself, to pay attention to what I'm eating if I do have that particular condition. I stay away from trying to down a bag of potato chips, that's for sure. I try to stay away from those things, especially at my age. I mean, I have a body that if I chew on a toothpick, I get fat. So, I mean,
in a sense, it is awesome that many of these cannabinoids do actually stimulate appetite, especially when we're speaking about GI patients with Crohn's. That is something that we want. We want to make sure that they're able to, consume food and be able to digest it. And then we also think about, patients going through chemotherapy. One side effect from them is not being able to eat due to the nausea that's caused. So cannabis is something that does help with that. I've seen firsthand a friend of mine who you also know, Marc, Jenny Perdomo, using cannabis to help with the side effects from her cancer. So
yeah, now, I tend to, on the munchie issue, I tend to stick to apples, oranges. I've discovered something really crazy lately. I've discovered the seaweed comes in these little thin wafers that you can buy at the grocery store at Costco. I just love them. My wife thinks I'm crazy. Yeah. But
I was reading the other day about meal prepping for your munchies and making sure you have those healthy snacks nearby.
Yeah, and that's something to pay attention to. It is a side effect. It's a side effect that's there. One of the questions came up: is it true or not that vaping causes metal inhalation? With the amount of testing and the amount of not only of the quality checks, I'll let you answer that one. I think that's a good question. I don't think that's a problem with vaping.
Especially not in the medical market. These things are regulated pretty heavily. Not to say that it is not a thing, because things happen, unfortunately. But a lot of these causes that we found out, especially I think it was about a year and a half ago with the vape scare. These products were coming from over the counter, and these are really poorly made vape cartridges, which would, after heating up, possibly cause metal flakes to also come off and be inhaled. The diseases that came from the actual vape cartridges themselves was more so from the actual MCT oil that they had added in, which after it had been added in, it created a foreign substance, which, had patients with lipoid pneumonia, popcorn lung. But, it was important. And Trulieve, actually, we were very forthcoming in making sure that patients were aware that none of our products do contain these metals, these foreign substances. And again, the lab reports will show that there's no toxic metals, there's no there's no bacteria, there's no microbials, things of that nature.
Yeah, I think it's great when you look at these. If you take a look when you're in the dispensary, ask to see one of these reports on the products that you're looking for. They'll show them to you. And it actually tests for metals and those types of things. They're pretty comprehensive. not you actually run two different types of quality tests, and also Trulieve, like all other medical cannabis dispensaries here in Florida, also are required to do an outside third-party test, do the tests that are there. So it's highly regulated. If you're using a medical, one of the reasons why you have a medical marijuana program and you use those products are to be able to get the quality products that you really need. You're not buying junk. You're buying stuff that really is going to be healthy for you.
100%.
Yeah. So let's talk about finding your sweet spot. I know that I mentioned earlier about getting your life back. I know in my case that's the case, and I've dealt with a lot of people. One of the reasons I do these webinars and people ask me why a retired guy like me is in this business. It's real simple. My goal every day is to try to help somebody get their life back, to be able to do something. I mean, if one person walks away from this webinar, from the information that they see here, tries medical cannabis, and they get their life back, they basically see this as an option to be able to help themselves, then we've been successful. Because there's been so much bad press about cannabis in general that's really not true. That what we're trying to do is get the truth out there. But one of the things about medical cannabis that's key is being able to find your sweet spot. If you find it, you will get your life back. And I know that it's something that's not hard to do, but the question is, how do you do that? So you truly, if you guys have come up with this formula here.
Yeah, I mean, these are definitely terms that are found in the medical field, but as somebody mentioned earlier, is it more of a trial and error type of process? It is a journey, but things that are important, the terms such as regimen, just figuring out what your day-to-day regimen is and how you're going to be able to use these products. And maybe you're looking for something in the morning time to really help keep you active and keep you focused, but you're not wanting that product that's going to make you fall asleep at night, like the 9-pound hammer or maybe our CBN capsules. So it's really starting that regimen and figuring out where you're going to take this. Everybody's used to, hey, take this capsule every 3 hours or every 4 hours. And, hey, that's kind of easy guidelines to go by. But again, with cannabis, it's not quite studied to the degree that we'd like, where we can definitely say, hey, use this indica capsule 5 times a day and you'll be fine. It's important that you're using a regimen. And on the right side where you see journaling, that's a huge thing. Being able to, hey, this is what time that I took this dose, how much I took of it, writing the symptoms that come down. Maybe you didn't feel anything. So now for next time, we should just use a little bit more. And that's what we call titration, is just being able to, hey, we're going to consume, as we mentioned earlier, starting low, going slow. We'll start with the 5 milligrams. And okay, after 30 minutes, maybe nothing's happened yet. So then we'll try a little bit more, and maybe we're at 10 milligrams now. Well, now we start to notice that our pain's going away. Effects are starting to sit in. And what we can then do is just say, hey, well, 10 milligrams at this dose at this time worked great for me. And we continue on. Eventually, you will have to titrate more, where you'll have to consume maybe 25 milligrams, 30. But that's where you also start looking into other products that you can start using in conjunction that will essentially increase those effects. Marc mentioned earlier regarding some of those different routes. Maybe you started with the capsule form and now the capsule is maybe taking a little bit too long to kick in, not doing quite enough. Well, maybe we use a vape cartridge for a little boost. Again, with the titration method, you're really starting with microdosing now. Microdosing is typically a dose 1/10 to 1/20 of a full dose. With capsules, let's just say a 10 milligram capsule. For ease, we would want to take about 1 to 2 milligrams just to see, where we can be at. We don't make a 1 to 2 milligram capsule, so maybe we'd have to then look at a tincture. And starting with that tincture, working our way up. And then after that, we can say, okay, we're ready for a full capsule. We'll see, again, through the titration, how this one full 10 milligram capsule can affect us.
Yeah, it's kind of like when, and I know a lot of people that go on diets, they tell you to eat maybe 5 times a day, a little bit of food rather than 1 or 2 big meals. It's very similar to that kind of a concept.
Exactly. I mean, and all of these are essentially the same thing in terms of if you're going to diet, you're going to need a regimen, keeping track of what you're eating, your workouts, microdosing in terms of food, and then titration even, hey, we need to eat a little bit more carbs today, a little bit more protein, whatever it may be. Very similar in that sense.
Right. And I think journaling is really, really important to know, like in my particular case, like I've got herniated discs in my neck. This is 24/7. It's not going to go away. So I have a regime that I take a product when I wake up in the morning. I have a program for that. I typically after lunch, I have one early afternoon. And then just in the evening, just before bed, I have a third one. And what I'm trying to do is I'm trying to go out and I'm trying to provide my body products during the day. Now I'll be higher on the THC and CBD than CBD in the morning. In the middle of the day, I tend to go more towards 1-to-1, and then in the evening, I'm higher CBD than THCs. Just to give you an idea of what I found is my sweet spot that's out there. But I think also one of the questions that Shelley was asking, sleep, that she's using some 9-pound syringe on a dropper and it's not working anymore. One of the other things that you probably should pay attention to is in my case, every 6 to 8 weeks, and every month or two, it's good to take a day to maybe 2 days off of using medical cannabis. And the question is, why do you do that? Because I'll use my body as an example. And I'm an old dog, and my body gets lazy. And when it starts seeing the cannabinoids coming in, it says, "Well, I don't have to work. I can kind of sit back. It's gonna be taking care of itself." And when the cannabis doesn't come into my body has to first of all wake up and start starting to produce the products that it needs to be able to address my particular situation. Now, in other words, what you're doing is you're kind of resetting the cannabinoids in your body, and what you'll find is your body becomes more receptive to the cannabinoids when they come back into your body, and you take less of it and get better effects to be able to have that happen. So, Shelley, it's one of the things you might want to do is you might want to try to just take a break for a day or two. Now, I say that because in my case, I take a day or two off. I have found that after a day, because of my neck taps me on the shoulder and says, "Look, you better do something within the next day or you're going to have a problem. The pain is coming back." So I really can't go more than about a day and a half. And I'm not addicted to cannabis. What I'm addicted to is getting rid of the pain. And I know what that regime is all about. But I am able to find that I'm able to use less cannabis product after I do this than I did before. And it's something you may want to take a look at. You also may want to take a look at, using a particular product. Go ahead and get a counseling session with Trulieve. Talk about the products that you're using. You may want to try another product just to be able to, again, reset your body. What's your thoughts on that, Zach?
Yeah, those are all great points, Mark. Sometimes you do need, kind of that tolerance break, if you will. I had mentioned earlier, what's great is using CBD regularly. It will prime your receptors, allowing for that THC still to get there as effective. But one cool new product that's come out to market and that we're starting to see more of is CBN, and it's Cannabinol is what it stands for. And it's actually a potentiator. So one, you're emphasized sleep. That's what you're needing help with. CBN is great for sleep. Is one of its main properties is known for that. It's also, again, a potentiator. So if you're using it in conjunction with THC, you're going to increase the effects that you're getting from that actual product. And the same thing can be said with CBD. So I know you were saying you're needing a sweet spot during the daytime, be functional, not psychoactive. Cool thing about CBN, it's also non-psychoactive. So using it in conjunction with CBD will increase the effects of that or whatever other product that you're taking. Those are found in a 5 milligram capsule currently. And we also now offer them in a true gel, 5-to-1 ratio. So 5 parts THC, 1 part CBN. So maybe something else to look for. It could possibly be, again, one thing that can happen is sometimes you get just too used to that strain that you're taking. Maybe looking at another strain that still has those same properties, same terpenes especially, and figuring maybe that could be it.
Right. Yeah, the answer is yes. Now, I'm going to go off topic just for a second. John asked the question of, do they test for herbicides and is Roundup used in growing? I can tell you in the medical cannabis business here in Florida, Roundup is not even part of the equation. The answer is no. Your thoughts on that, Zach?
Absolutely not. We are allowed, I'm trying to think of the proper term here because there are a lot of
organic anything that you're using for fertilizers are more organic than anything else.
They are organic pesticides, which are, they're not harmful. They are tested for, and in the final product as well through the lab testing, they'll even show you that, none of these herbicides, these microbials are found in the actual plant.
Yeah. So, John, I hope that answers your question. The testing will take care of the anything, you're not going to be getting anything bad in the products. If you use Florida dispensary products, the testing that goes in there is pretty rigid. I know that one of the questions that Susan brought out, she brought it up in the chat, was, is it safe for kidney disease on dialysis? That's something that's really important. I can't answer that question straight out. Really, you need to talk to your doctor, you talk to your medical marijuana doctor, and also your medical doctor. It should not. But again, because every person's body is different, and I don't know your particular case, and I don't know your particular situation, I would say I'm going to err to the side of caution and recommend that you talk to your doctor and your medical cannabis doctor. And at the same time, get your dispensary tapped into that so you can actually figure out the type of cannabis that you can use that can particularly address your situation. Again, it's something that should not cause a problem, but again, it depends on the biology of your body, and that's what we have to be careful about. I hope that answers that question that's out there. Is there a couple other questions we want to take here? What do you suggest for pancreatitis? You have a comment on, Zach? You want me to answer that one?
Go right ahead.
Yeah, I would, again, pancreatitis is something that, again, is brought on by a lot of inflammation. I would look at a higher ratioed CBD type product. And again, based on your biology, try it, not just a 1-to-1 product, but maybe try a 4-to-1, 4 CBD to 1 THC, and see how that helps. See if that helps your particular situation. I think you'll find a higher CBD based product will help with that quite a bit. But there has to be a certain amount of THC in there to really address the pain side and to be able to really address that. So try that. And again, I can't emphasize more. It depends on your body. But I think if you stick to the higher ratio of CBD products, I think you'll find that that'll be something that could help you quite a bit. Shelley, going back to what your whole thing, take a look at the products. Again, take a look at products that come from a quality vendor, like a quality dispensary, like Trulieve. I think that'll help you quite a bit in what you're looking at. One of the anonymous questions was, I bought 2 gel topicals, both 1-to-1 with THC and CBD with Areca in it. Which is better for me? You have an idea what that's all about? I don't know Areca.
Yeah, I don't know which one that is either. The gels and the topicals will all depending on, what you're exactly looking to seek and relieve, really. Some people it's for preference. Other people, they're worried. Some people who are worried about their job, let's say, they want to use more of a CBD muscle rub because they're afraid potentially that it could show up in a urinalysis. But with those, it really is more dependent upon the person and what works best. Yeah,
I think that's something that they're again. One of the questions that Carrie brought up is she was talking about full strength CBD. I don't know quite what. I think there's really what you want to do is you want to have a little bit of THC in the CBD product that you buy. Okay, and I think that's really important.
Yeah, and I hope that I'm answering your question right. When you think of full strength CBD, I'm assuming you're referring to full spectrum, meaning that it does contain THC in it. If you're thinking of CBD isolate, that is only going to be its CBD self. So it's gone through a purging process. It's gone through a distillation process where you're only isolating that one cannabinoid, meaning it also does not contain terpenes either. And then we also have more of a broad spectrum, which is still going to be primarily CBD, maybe has a little bit of THC in it, but very, very little, especially when you think of those hemp products. Now, if you're getting a product that is more CBD derived on the cannabis side, you'll probably see more closer 1 to 2% THC in each of the products. But again, we do also have CBD isolates, distillates coming out, which, if you're looking for just a pure CBD product, those are available, also available in tinctures too, which contain very little to none THC.
Right. One of the questions came up is about passing a drug test. You want to test that one? Or you want me to grab that one?
I didn't see the question. Okay.
It says, what about passing a drug test? Look, if you're using medical cannabis, candidly, if you're using CBD by itself, you will test for marijuana. Okay, and I know that there's a lot of employers that do test their employees or basically have you take a drug test prior to becoming an employee. And if you're using medical cannabis, you will test positive for it. Now, Some companies, in fact, more companies today than ever, especially here in Florida, if you have a medical marijuana card, are basically saying, fine, if you're under, you have a doctor's recommendation and you're using this, then it's okay. Some companies say zero drug tolerance. That's it. You're out. So you will test positive for a drug test if you're using medical marijuana.
And even using hemp products over the counter, you still run a risk of containing THC in your system. Through using the titration method itself, you're using it often and frequently. Therefore, you're going to have more cannabinoids build up over time. So if a drug test is something you are worrying about, I highly recommend speaking with your employer first. And if they are okay with it, then go get a medical cannabis card, especially to save you.
Right. Shelley brought up an interesting question. She says, I'm using CBN and it doesn't help with pain, a little with sleep. I think what you're doing is you're talking about CBN. If you're taking a look at just one isolated component, the answer is then you're going to try to reach all of them. I think if you go more to a whole plant approach, I think you'll find it'll help you not only with the pain, but it'll also help you with the inflammation and your sleep together. What's your thoughts, Zach?
Yeah, and I noticed that she had commented she does not use flower. I'm not sure if she does, vaporize. If so, we do have products which are known as our True Spectrum Pod or our Blue River rosin cartridge, which will again provide more of those full entourage effects. They'll have all phytocannabinoids involved, whether it's CBD, CBN, CBG, THC, etc. But then if you want to just add that increased benefit of using CBN alongside it, it's definitely a great idea. The only problem right now with CBN, especially if you're trying to really use it with pain, it's so hard to actually isolate CBN on itself. You're really going to need to take, probably 10 to 15 milligrams versus just a 5 milligram capsule. And again, because of the non-psychoactive effects, sometimes it can kind of play a mind game on people where it's just not working for them, but it is working. There's actually a study done that shows that CBN does help with neurodegenerative bone disease. So patients with Parkinson's or arthritis could use that as well. And I also find it interesting. She stated she's weaning off of benzodiazepine. There's a study done recently that shows for every 5 milligrams of CBN that you use, you can also typically relinquish 1 milligram of your opioids or opiates.
So again, I would just broaden out, go beyond just CBN. Look at a product that has more of a broader range of CBD products, as well as
full
THC
spectrum product. Yeah.
Right. I take a look at full spectrum. I think you'll find it help quite a bit. So I hope that answers that question. One other question is, where can I get all these products not in Naples? Like, you have a dispensary in Naples.
We do have a dispensary in Naples. I know there's also, I think it's Fort Myers as well. If you're ever having problems with obtaining products, please reach out, whether it be your local dispensary or maybe even your local physician. Again, I'm a community educator. I do work with quite a few of my physicians. And one thing that I do, harp on when I'm working with them is, if your patients aren't receiving the products they need, let me know. One thing I can do is kind of pass that along so we know, like, hey, we need more focus on CBD products in Naples, or we need more focus on THC or maybe a specific product even, and we can figure out ways to be able to get that product to a certain patient. If you're looking for all of these products that we mentioned previously, though, they are available at Trulieve. Sometimes being one of the busiest dispensaries in the state does come with not having all of it.
Right. Now, there are some do's and don'ts about using medical cannabis. I think we mentioned earlier, what you want to do is you want to take a look at a product that has been independently tested. Every manufacturer of whether it's CBD or medical marijuana products does their own testing. And like I mentioned, I know that Trulieve does 2 tests internally, but also you have a third-party independent test. And those tests are all available that everybody can see the quality or the purity of the product that they buy when they buy the product from you. Is that right? Is that right, Zach?
100%. All of our products are independently tested and approved by ACS Laboratories, is the partner that we work with. And each product that comes out, it has to be approved by state regulations. And again, purity, potency, safety is our number one priority.
Yeah. Excuse me. I think the other is that When people look at pain management, you also have to look at an overall pain management plan. I know that sometimes when you're looking at pain management, you're looking at just taking cannabis, but sometimes things like stretching, things like exercise, things like yoga, I do Tai Chi, to be able to just help you overall, just be able to complement that medication with some exercise and some other programs that can help you complement the medical cannabis. Because what we do is we don't have a magic wand and we don't have fairy dust. We have something that can help you, but overall, your overall basic health is what you're really looking at. And that's where exercise tied to medical cannabis, for example, and or watching your diet can help quite a bit. And one of the things we recommend is when you're first starting out, choose an oral product like a tincture rather than starting with vaping, and something that just go with low doses in the evening. And again, go low and go slow. I think you'll find it a lot easier to start with an oral product, starting with the lower doses, and then being able to move up from there. And then again, I use the vaping products because I want the faster onset to address my pain. And if that's that's your situation, mix and match I use a tincture and a vape pen to be able to address my particular situation.
Yeah, especially starting out, like you mentioned, oral products are going to give you a better, idea of an exact dose versus inhalation products, whether it be smoking or a vape cartridge. We can kind of guesstimate in a sense, but everybody's lung capacity is different, lung volume as well. So, for each person, it's a little harder to determine, hey, you vaped, 1.9 milligrams in that 3-second inhalation versus an oral product where you can easily dose out 10 milliliters, 5 milliliters, and be able to consume it that way, or capsule form as well.
Right. And then also, I think it's important to talk to your doctor. You have a medical team. It's your medical doctor, it's your medical marijuana doctor, it's your dispensary, and more importantly, it's your body. Listen to all of them, but more importantly, the number one person to listen to is your body. Your body will tell you what's working, it will tell you what's not working. And that's what's really, really important. Some things to not do. CBD shouldn't be your first choice for pain relief. CBD is great for inflammation. It does an okay job with pain relief. A lot of people claim it's a great pain reliever because what they're doing, and in the case of gastrointestinal disorders, reducing that inflammation reduces the pain. So that helps quite a bit. There's no question in that particular case, CBD is reducing inflammation, which reduces the pain. But if you do have pain, you should consider some THC, supplement some THC in there to address the pain component of it. And I think that's really important to pay attention to that. Don't be afraid of THC. If you take too much THC, if you get high, if you have a bottle of CBD oil, take the CBD and it'll take you down from that high. So you have a way of actually regulating that if you do happen to, but again, go low and go slow, and you'll know exactly what your tolerance is. And if you reach your tolerance and go over it, take a little bit more CBD and it'll bring you down into that homeostasis state.
Yeah. And especially, we've talked mainly about THC, but really didn't break down that there's Delta 9, Delta 8, which we'll go over in a little bit. And maybe Delta 8 is somewhere you start with first before going on to that full Delta 9 experience.
Right. And I think also talk to I talk about your healthcare team, primary care doctor, Medicare doctor, your dispensary, and yourself. That's really, really important. And some people ask, should I just stop taking the prescription drugs if I'm on it? The answer is no. What you want to do is, again, you want to wean yourself off of the prescription drugs and by using a little bit more cannabis, and then try it by taking a little bit less of the prescription drugs. You'll be able to find yourself how you can be able to just, again, go low and go slow and ease your way through it. It's not a cliff that's out there. It's not black and white. It's more of a darker shade of gray as you go through this thing, and try it as you go along. Now, let's talk about Trulieve for a second. Zach, tell me about your company, what you got.
Yeah, so Trulieve, Florida's first and largest medical marijuana dispensary currently. We have 78 different locations currently throughout the state of Florida, rapidly growing, especially, one of our biggest priorities is patient access and making sure patients have the availability to purchase their products, whether it be flower form, oil form, some of those other routes that we talked about. But one cool thing that Trulieve offers, which many other dispensaries don't, is our true nanotechnology. When you think of the nanotechnology and the science that's been provided for cannabis, especially in just, and me personally, and the kind of the nerd that I can be, I get so excited to think about where we'll be in 10 years with some of these products we're already coming out with. But just going over these nano products, what happens essentially is through sonification or vibrations, if you will, we'll take that THC molecule and be able to break it down into smaller molecules, being able to create higher bioavailability. And what that means is that you are able to then consume more. Your body and your receptors will be able to consume more of those THC molecules versus had they not been broken down with sonification. One way I like to kind of, image this for many people is, taking a chain link fence. And if you have your regular, THC molecule, we'll think of those like a tennis ball. Taking that tennis ball, trying to throw it through that fence. If you had 10 of them, you might get maybe 2 to 3 actually through those holes in the fence. And those fences we'll think of as our receptors. Then let's break that tennis ball down with sonification and maybe get a golf ball size particle. Being able to then take 10 of those and be able to try to throw that through that same fence. Again, you're increasing the bioavailability of it. You're now getting 90% upwards. And these are products that are available in 1 to 8 or 8 to 1. When we think of ratio products, typically CBD will be the first number and THC being the second. So maybe if you're looking for a daytime use, that 8 to 1 ratio tincture might be a better option than versus the 1 to 8. And how we talked earlier about the anandamide being the driver of the actual, molecule and taking THC or CBD. Now it's like you had just one driver. Anandamide was like an Uber for one person. And now it's, taking the whole family, basically. You're getting 4 or 5 different molecules of THC being delivered to these different synaptic nerves and being able to consume more of these. And these aren't just available in tinctures. We also have them available in what are called our sublingual drops or true tincture drops. These are basically like lozenges. So they're available in different flavors.
Over here.
Yep. Different flavors. We have them available in CBD only, THC only, and a 1 to 1. And we also have our true powder on that right side, which is also different flavored. We have vanilla cream and lemon. And those are just, different options. These are 2 products that came out before edibles were really allowed. And we were just trying, again, how I mentioned patient access being our number 1 priority, trying to figure out other ways to be able to provide this to patients. We got a lot of responses regarding they didn't like the taste, whether it be the tincture, RSO, True Clear. And how can we put these in beverages? Well, the great thing is that True Powder and our tincture is water soluble. So you can actually mix these with beverages and consume them discreetly, discrim them in your favorite choice of beverage. I hear all the time about how people love their True Powder with their coffee. It's just a little extra added boost for them. So,
I put it in my smoothies, which is great.
Yeah, smoothies. I actually use it in my protein shakes after I get done exercising. I'll put those in there because, again, THC being great for anti-inflammation and being able to help with that muscle recovery.
Sure. And one of the things that's great about the Delta 8 products, they work for pain. I can tell you when I had my knee surgery, and knee surgery is no picnic, I was part of Jewett Orthopedics guinea pigs to try medical cannabis as a post-surgical, for post-surgical pain relief. And I basically, in fact, I was turned on to the Delta 8 products by D. Just thought I'd let you know from Trulieve. And they help tremendously. And I typically like the 1 to 1 to 1, the True Pod 1 to 1 to 1, which is Delta 8, Delta 9, and CBD. Because I'm not just trying to go after just the pain itself. I'm also trying to get rid of the inflammation. And that's why the 1 to 1, the CBD Delta 8 is also very helpful to me as well.
Yeah, and as I mentioned just briefly earlier, Delta 8 is more like Diet Coke, to Coke. Delta 8 has many of the same benefits as THC does. What's also great about Delta 8 that THC doesn't provide is the anxiolytic effects, where it actually is anti-anxiety. So it is more of a calming relaxation than that psychoactive high that you can get from Delta 9 THC. Really, the difference is in a scientific term, Delta 8 is a double isomer compared to Delta 9. And just with that one covalent bond, it really, does so many different effects. It's also antiemetic, meaning that it's great for nausea. It's a neuroprotectant as well. So similar to CBD, it kind of has the best of both worlds. And again, going back to maybe you've tried CBD and now you want to get into the possibility of THC. Well, Delta 8 could be like, stepping your toe in the water versus just diving right in and being able to just, hey, we're going to try Delta 8 first, see how it works. Again, many people don't like the psychoactive effects that THC provides. So this is also another great starting point. We have it available in many different forms, whether it be a vape cartridge.
Yeah,
as well
the Delta 8 CBD 1-to-1 is great.
Yeah.
Like I said, I prefer the 1-to-1 that's out there. But look, I want to, as a testimonial, these products work better than Percocet. When I had my knee surgery, I found that this product worked much better than any drugs that the doctor could give me. In fact, it was probably the thing that not only carried me through the thing, but also helped me recover as fast as I did.
That's a strong statement too.
Yeah, and let me tell you, it's no picnic. Let's put it that way.
I believe it.
But thank you for that. Thank you, Trulieve, for that.
Yeah.
So let's kind of wrap this up a little bit. We've talked about a lot of subjects, and as I mentioned earlier, cannabis isn't a fairy dust, and it's not a magic wand. It is something that does help with all this stuff. But there's also things that you got to pay attention to. You're basically self-care. You're pay attention to. Talk to people about your particular situation. You'll be amazed how many people can help you with certain pieces of advice. I know a lot of people get into an environment that really helps them out, whether that's with animals or with therapy. Pay attention to your diet. Pay attention to just taking 5 minutes. And I said, I have a common thought for myself. I buy myself a glass of wine and just think about myself, think about what I'm doing, why I'm doing it, really help ground myself. That helps quite a bit with being able to address a lot of the situations that I have.
Yeah, especially with cannabis, cannabis is wellness. And when you think of wellness, you think about, taking care of yourself. One, your body, many people say a cliche, your body is a temple. Treat it as such, you're not out here consuming, alcohol every night. You're not using this, in a sense to, as a recreational drug. You're really using this to help better yourself and better your body. And again, as Marc mentioned, this isn't just a one-stop shop kind of thing where if you just use cannabis, your life is going to magically get better. You have to take those steps to be able to also ensure like your lifestyle changes are better, your lifestyle choices are better. Me personally, I like to meditate. Affirmations are something that's huge in my mind. One thing I always live by is just the people that you're around the most is who you become. And I make sure to put myself around, smart people, educated people who they want the best for themselves. So, again, cannabis can help for these things, but you also got to be willing to make that step as well.
Right. I mean, I as an older senior citizen, one of the things I've got into lately has been Tai Chi. It helps me be able to ground myself at the end of the day. After a busy day, it just helps me be able to just reset myself and really put myself back into a state where I'm calm and where I really want to be. So pay attention 100%. To a lot of those things.
And one great thing that one of the biggest, diseases, if you will, killers in America is stress.
Right.
Stress is the number one cause for suicide, for many different things. And cannabis does really help with that stress. It really does help take and relax a lot of the life doings that are happening to us. Life is not easy. And many times we have to make sure that, we may just need a crutch, and this is a healthy crutch. It's not something that, as we mentioned earlier, has ever killed anybody. So it's something that you can kind of use as like that glass of wine to wind down your day, to really, sit back and kind of just take back everything that's going on and realize like, okay, it's not that bad at the end of the day. We can, tackle this. Just got to think your way through it.
Right. Well, listen, if anybody has any questions, now's the time to ask them, because we're going to be wrapping up. And Zach, do you have any follow-up, any questions you want to end with? Or any comments you want to end with, I should say?
Yeah, I just want to say thank you very much. Everyone who joined tonight, it is much appreciated that you came to listen, came to become informed. Most importantly, with cannabis especially, it is not like your other medications. Again, like we talked about, where physicians can't necessarily just tell you like, hey, use this 3 times a day and it's going to work for you. Cannabis for patients is homework. We have to also be the ones to take control of our lives, of our regimen, of these doses, and making sure that, hey, doc, this product's not working for me. Being honest with yourself as well, and just making sure you're going to be someone who holds yourself accountable and continues using this. Don't think, again, this is a one-stop kind of thing, or it's going to happen overnight. It is kind of a journey, but as patients, it's our duty and to ourselves to really make sure we take control of that and also do our homework. This has not been something that's been around. So, give your physician a break if he can't necessarily answer your question. They were not studying this, back in med school. So this is all foreign to many people.
Yeah. We did get a question about from an anonymous user about their digestive diagnosis was many years ago. Can a medical doctor be able to prescribe the medication? The answer is yes. Now, if you have your medical records, that was one thing. If you've been diagnosed by a doctor, it will be in your medical history, and you can give the medical marijuana doctor access, the authorization to look at your medical records. And with that, they can be able to help you with that. That's out there. So the answer is yes.
100%.
Talk to your doctor. Yeah.
Many people do not think that they qualify for cannabis. They see the 10 conditions that are out there. Just know that if you've seen a physician, there are more than likely a way to be able to say, hey, you also qualify for medical cannabis. There's a condition called the like kind or class, which will allow for different, diseases or conditions to be able to also become patients in the medical cannabis field. So, talk to your providers. Especially if you have these records, makes it 100% easier for your physician who is a cannabis provider. Right.
Now, that's where Florida really got it right. By coming up with that condition, rather than trying to list 300-400 different conditions, they're literally leaving it to the doctors, which is where they should. And this 100%. Is where I'm going to throw my plug in. Leave the doctoring to the doctors and politics to the politics.
And that's a great point. The THC caps right now, if you're listening to this, make sure you call your local state reps and let them know. Do not mess with my medicine. What they're trying to do right now is a 10% cap, and we need to make sure that they hear us and they know that this medicine works for us, and they are not medical providers. Therefore, they should not get in between that relationship.
Yeah. And let doctors be doctors. And that's really, really important. Well, I'm going to wrap this up and say thank you to everyone who's really been with us for the last hour and a half. We really do appreciate it. And again, our goal is if just one person can get their life back, if we can help just one person, then we feel that we've been successful. And that's what this is all about. Cannabis is something that will help you get your life back. It's not a pill that you take and magically something happens. But if you use it, if you go low, you go slow, and you pay attention, you work with your doctor, you work with your medical marijuana doctors and your practitioners, you will find that within a week or two, your life will become much better. And that's really what it's all about, the quality of life that's out there. I do want to shamelessly throw a plug for our medical marijuana webinar next week, which is on, it's going to be on medical marijuana for treating addiction. And that's really an important one. Dr. Sherry Kaplan is joining me for that. And she's done a lot of work in this particular space. So if you have someone that has addiction problems, or you're worried about or if you have addiction problems, or you have someone who's worried about it, it's a good webinar to attend. She's very good at what she does. So please feel free to join us. And Zach, I want to thank you. Not only thank everybody for joining, but I want to thank you. Great comments, and thank Trulieve for the sponsorship.
Well, thank you very much, Marc, for having me. This was a blast. Kind of get my feet in the water and being able to do this for the first time was a great time.
Yeah.
Look forward to hopefully being back.
Yeah, I do want to say there's a couple of people in the background that aren't on the screen, but they're here. It's Lee Jones and Deja. They've been answering a lot of questions and things in the background, and I want to thank them for their work. Without them, we really wouldn't be able to do a lot of what we do. So the team is thank you very much, and I'm going to throw a claim also. Thanks for Alyssa Katera. She's the one who came up with this whole series, so she deserves a lot of credit. But thank you again for everybody for attending. We really appreciate it. Thank you for sponsorship, and I look forward to working with you again.
Awesome, Marc. Look forward to it as well.
Everybody have a great week, and stay safe.
Stay blessed, everyone.
Thank you.